on North of 60. I'm Heidi Schweighofer. Our subject today is elder law. I never knew that elder law was a law specialty until very recently, and so we all have a lot to learn about it today. My guest is Terry Donner. Terry has been a registered nurse and an attorney for over 30 years. She's also a certified case manager and a certified senior advisor. Thank you, Terry. Good credentials, kid. Thank you for being here.
Thank you for inviting me. I'm really happy to be here. It's exciting.
I want to know why you decided law school. You were a nurse first.
Yeah. Well, I'll tell you a cute little story. I actually, my father was a police captain, and he would come home for lunch, and I'd been a nurse for about a year, and I still lived with them, and so he came home, and the routine would be he'd take his gun off and put it on the table and sit down, and I happened to be home. I worked second shift, and I sat down with him, and I said, "Dad, I have something to tell you," and he said, "What? You didn't ruin your car, did you?" And I said, "No," and he said, "Well, you know, what do you have to tell me?" So I said, "I'm going to law school." And his face fell, and he said, "You're doing what?" He was so distraught that I was going to law school because he thought, you know, he dealt with the criminal system.
Oh,
and I said,
sure.
"No, Dad, no." I said, "This is what I'm going to do." I said, "I'm going to represent healthcare organizations. I'm going to represent older people and try to enforce their rights." And he said, "What do you mean?" And I said, "Well, you know, at my clients, I worked in a big inner city hospital, and I said, so many of them go home with this wonderful plan of care, but they have no way to implement it.
Exactly.
They don't have anybody at home to help them. They don't know how to get home care. They don't know how to get benefits." And I said, and they end up coming back to the hospital. And it's heartbreaking. And so, you know, I only get so much time with my patients. I said, but as an attorney, I'll get to spend a lot more time helping them. And so he thought about it, and so he reluctantly agreed that it was a good idea.
Good. And then you started law school.
I started law school.
Now, tell me what a geriatric case manager is.
Okay, so that was something interesting. My mother got very sick, and I decided, and I had this job, I was flying around the country doing health law and elder law on the side, and I decided my mom needed me. I needed to quit my job and open my office, my own office, 0.3 miles from my house. And I opened a little law practice, an elder law practice, and I opened what I call a geriatric care management practice. 30-some years ago, that really wasn't a popular term, but I found an organization that would credential me. And basically what we were doing at the time, it was mostly nurses or social workers who were actually helping people stay in their homes. They would go into the home, see what their care needs were, set up care, fill their pill boxes. If they needed an occasional dressing change, we'd pop in and do that as well. Something that, anything that they needed an RN or to do to actually keep them in their homes. The other piece to that, which is what my focus really was, less hands-on care and more, you know, what's the plan going to be? When you can't stay here any longer, where are you going to go? Bring the family in. Start to talk with the family about what your needs are going to be long term. You know, as we age, because we're living much longer than our parents' did, our parents never went through this with their parents. Usually they had a short illness and passed away. Now people are living much longer, and they're living with one or two chronic illnesses. And those illnesses affect our basic daily needs, our basic ability to dress, groom, toilet, eat, and
go to appointments, pay the bills, deal with all of the medications. Yep, you've got it.
It saps your energy. So how are we going to do that for our parents if we're physically not going to do that? We're not all nurses, and we don't all have the constitution to do that. You know, so that might not be our choice. Or you may have a son who doesn't want to toilet his mother. You know.
Sure.
How are you going to do that? How are you going to develop a plan of care for your parent? How are you going to pay for it? How are you going to do all of those things and put the care in place and monitor it? So basically, that's, for me, what the geriatric care practice grew into. And so my Aging Matters is my care management practice, and I do still go into homes and sort of set up, you know, what will be the plan of care. or help them transition out of the home into a facility. What's a good facility? I'm in and out of facilities. What is a good, there's no one good facility. It depends on what that person's preferences are.
Right.
What may be important to you or me may not be important to somebody else.
Right.
And a lot of times location is the most
I
important
was going
factor.
to just say that, location, so that family can visit the person or the loved one.
Yeah.
When you speak, I want to just interrupt one thing. When you speak about caregivers, you can also be a caregiver as a spouse, can you
Yes.
not? And I think that I have come across people here in Hudson who are older women taking care of an ailing husband, or vice versa. Usually it's the women taking care of the men. And I want to make sure that caregiving in your eyes literally means caregiving and not just child taking care of patient or parent. It could be spouse taking care of
It definitely
spouse.
could be spouse taking care of spouse. And, you know, a lot of times that's the first step. The mother, the wife will be taking care of the husband, and the children are in the background.
Yes.
And it's important to bring that whole family
Yes.
together to see
Yes.
how can you support that mother. How can they don't
the mom
parents,
and dad
yeah,
both, yeah.
The parents don't want to be a burden, and the wife doesn't want to give up her caregiving responsibilities. You know, she wants to take care of her husband. They want to live independently. They don't need the kids interfering, is what they think.
Oh,
So-
this is close to my heart,
Yeah.
I'll tell you. And you took care of your older parents
Yes.
until demise.
Yes, yes. Probably over the last 22 years, I've been caregiving. My mom got sick when she was in her early 70s, and she was the reason I opened my elder law practice and my aging matters practice. So I guess they're dedicated to her.
Excellent.
Yeah, she's an amazing woman. But she had 2 chronic conditions: congestive heart failure and chronic obstructive pulmonary disease, lung disease. And those 2 needs had to be balanced. And so, you know, it was a fine line that we walked with her to try to keep her as independent and as healthy as possible. And thank God we were able to keep her home until the end. So,
Good.
and manage
What
her
a blessing
care.
for her, too,
Yeah,
to
yeah.
be able to
She's
stay
a great
home.
lady. Yeah.
Terry, what would you say is the first reason that somebody would consult you rather than a probate attorney, as we
Yeah.
talked about, or another kind of lawyer?
Well, it's interesting. People don't know what they don't know, and that's not their fault. You know, these are families who, you know, love their spouses, love, you know, children who love their parents, and they're scared, and they probably have encountered a fall or a stroke or some health condition that just really set the individual, the care recipient, back, and they're not functioning up to par. They can't be left alone, and so they're in crisis mode, and they're calling me, and they're saying, "Are we going to lose the house?" The house seems to be like the big asset everybody's worried about. The house is probably, in my opinion, one of the easiest assets to protect. We're more worried about the retirement accounts, the other assets that the individuals have. But you know, I meet them where they're at. And I say, well, yes, there's many things that we can do, but we need to look at the whole picture, you know? A lot of times people will just want a quick answer over the phone. Just tell me how to protect the house. Can't do that. I said, you know, I certainly can't do that because there's so many things that impact your situation. We really do need to sit down for a consult. If they don't want to do that, then I know they're not serious about planning. You know, they just want a quick fix, and there's no quick fix in elder care.
Do you coordinate with the hospital? My
Yes.
experience was with my father and mother, both who were in and out of the hospital in their later years, that they discharged. Okay, now they're going home. Whether they can get around the house because they're now not ambulatory, or whether they can do, whether they've got cognitive issues and you're giving them 20 medications,
Right.
that didn't seem to play into at least what my sister and I experienced with my parents. So do they call you or do you call them? Does that ever happen that you say to the hospital, hey, you know, maybe, I don't know how to word it exactly.
Usually the call comes from the family.
Okay.
Now I will get referrals from, sometimes the case manager or the social worker at the hospital. A lot of times it's the geriatric assessment units. They will tell the family, you need an attorney and you need to talk to Terry Donner. She'll help you.
Good.
And, that's how I'll get that referral. But a lot of times it's just the family desperate. And, Medicare has a newer rule that says, if your family member is frail, pretty much frail, not able to make their decisions really, and needs help, definitely they are supposed to contact the primary caregiver that's designated. That person is designated, supposed to be designated upon intake, and they're supposed to work with that family member and supposed to help with discharge planning. Now, in the world of COVID, everything seems to have gone out the window.
Right.
And so even if they are talking to you, it's not the same as before when you could go up face to face and sit and they knew you were the family member because you were there every day and you were the one talking to the nurses, talking to the doctors, waiting for them to come in. Now it seems to be a lot less personalized care. You may be calling in, but you're getting different nurses on different shifts who are only giving you their worldview, and they may have spent 15 minutes with your parent. So it's very difficult.
So with that in mind, gosh, I wish you had been around in Michigan when we were going through all of this with my parents. What is the number one question that brings a caregiver to you, and what is the question they have?
Like I said, if they're looking at the parents' finances and looking for benefits, it's the house. If they're looking for care, they're looking at how do I bring my mom home, and how am I going to afford to go back to work and bring somebody into the house? Or should I be placing my mom? Where do I place her? What are my options?
What are the options?
What are the options?
Yeah.
Can you explain the system to me? How does it work? What if I feel my mom's not ready for discharge? Is there an appeal that I can do in the hospital?
No. In my case, no.
Yeah.
That it's too bad is
Yeah.
basically it. Yeah.
No, there's a state appeal process that you can do. So I wish I knew you that.
Oh man, we
So,
went through a lot.
I'm
really.
sure you did. And it was before some of these things were maybe legislated into place as well. Yeah. We've come a long way. We've come a long way, but we have a long way to go. And so yeah.
So Terry, I have known of a number of cases of caregiver children and caregiver spouses dreading having to be on Medicaid.
Mm-hmm.
So I want to, because of the spending down and all of that, I want you to talk about Medicaid, particularly if someone has to go to, the Medicare funds are now not going to go towards whatever they need, and they need to have Medicaid as their insurance.
Right.
Talk about Medicaid a lot. Okay. I'm really curious about it.
Well, Medicaid is basically, the state funding of long-term care. They don't automatically fund your long-term care. They expect you to pay for your care as much as possible. But what we do is we do something called Medicaid planning. And so we help the family protect a certain amount of the assets. And a certain other amount of assets may go for their care, other exempt items. So the program looks at say we are talking about an individual, say there's a single parent at home,
Okay.
A widow. And basically what they'll allow you to do is keep up to $2,000.
Oh my heavens.
Yeah. So you have to spend down. Well, what do you spend down on? Well, we spend down on exempt assets. We make sure that we pay for the funeral. We can pay for the children's funeral. We can pay for certain items, their cemetery plot, their casket, or their actual, I want to say the urn, things like that.
Okay.
So there's certain things that we can pay for, not the whole funeral, but certain things that we can pay for each adult child and their legally married spouse.
No kidding.
Mm-hmm. People don't know that.
No.
So, if you look at the funeral costs, burial costs, they're
astronomical.
Mm-hmm.
I agree.
Right, and so we look at those issues. We look at, does mom need a new car that the caregiver may drive around and take them to appointments, but is in mom's name.
So that's allowed.
Mom's allowed to have a car, and so she could have a car. We look at if we're going to maintain mom at home and have Medicaid home care, we look at maybe we need to put new furniture in there. We need a new furnace. We need a new washer and dryer. Or we need to fix up the house because it's something that's going to be sold. Now, a lot of times a child may have been living with the parent for 2 years, and it's called the caregiver exception, 2 years prior to their institutionalization in a nursing home, and we are allowed to transfer that house to that child. And so we'll fix that house up, before we transfer it to the child.
I had no idea.
Yeah, there's hoops and bells and whistles you have to go through, but you do need to talk with the physician. You do need the physician to fill out paperwork that says that basically, but for this child living with the parent and rendering care, mom would have had to gone to that institution 2 years earlier. And there's an affidavit the child fills out, and sometimes I'll get statements from other people too as witnesses that they were rendering the care. So it's something that's a little bit of work, but it's well worth it. The key is coming early enough. And what is early enough? I really do believe that prior to your parent or your spouse or you becoming ill, that's when you need to start your planning. When you're starting to retire, that should be part of your planning. How many people retire and then become so severely ill?
Right.
It doesn't mean that we're transferring assets at that point. It doesn't mean that we're doing anything with your money. You still are in control. But what it means is we have a plan in place. We know who's part of the team. Who's your accountant? Who's your attorney? And it's not just any attorney. It's not just the attorney that did your mom's will of 20 years ago. It's got to be an elder law attorney, somebody who's familiar with the elder law idiosyncrasies. One of the things that I've seen is people will come and there's an option to do a Medicaid pooled trust. And it's a nice little vehicle to put money in that will qualify mom for Medicaid right away, but yet there's money there in case she needs a private room or other things. You can draw it out. You can't do it if her power of she's incompetent and her power of attorney does not give you specific authority to do that. Well, if your general attorney drafted that power of attorney, your general estate planning attorney, they won't know to put that in necessarily.
So that is so different from the picture that I have of, or the horror stories I've heard about people spending down and left with nothing. Mm-hmm. And then they're in a nursing home.
Right.
No money, no car, no house, no fixed up house, no nothing. And I'm just hearing something so positive actually about if that has to happen.
I mean, there are techniques to, like I said, preserve some of the assets. You have to think about the fact, though, that, we also look at the income. So your Social Security, your pension, all of that is going to go to the nursing home except for $50 a month, unless you have veterans benefits, the aid and attendance. We'll get to that. It's a little bit more. But the thing is, so if I have only $50 a month that I keep, and I have that car, if one of the kids doesn't pay the insurance on it, then
there it goes.
There it goes. And then if the kids are paying the insurance on it, is that going to be income to me that I have to declare and give to the nursing home? So there's all kinds of planning that needs to go around that.
Heavens, how complex.
So maybe there's a Medicaid pooled trust that allows you to pull out money to pay the insurance on the car. Make
Is there a
limit
on that Medicaid pool trust?
No, you can put as much money in.
So someone could put $1 million into that and draw out, or would that be seen as kind of
if you have $1 million,
fishy?
If you have $1 million, we're probably going to be talking more than just Medicaid planning. We're going to be talking about other things. We're probably going to be talking about maybe some specialized insurance, things like that will pay for your care, rather than just transferring out your money into something like a pooled trust.
Terry, I had a quick question. Home health, and I'm deviating, I apologize, but I'm really curious about this. Home health of any plan for someone who cannot necessarily take care of themselves anymore. They're still actively, alive, but they cannot,
Right.
they can't fully take care of themselves. Is home health the most expensive option rather than independent, not independent, what do you call the one? The
Assisted living?
Assisted living or something else. So do you have to weigh all of those things
Yeah.
and look at assets as compared to?
That's an excellent question. You've done your homework. The actual cost of a home health aide, a non-medical home health aide, just somebody that comes in and does custodial things. They'll help you bathe, they'll change your sheets, they'll make you dinner, they'll sit with you, they'll transport you to your medical appointment. On average, $25 to $28 an hour. And 25 is probably a little bit low right now. It's a lot. And if you add it up and have 24-hour care every day, you're going to be at over $15,000 a month.
Oh my.
Unless, unless you can get a live-in, somebody who will live in and maybe negotiate a flat rate. And some of the agencies do have a live-in rate, and they will find you a live-in. You can find a live-in on your own. But you have to be careful, because if you're finding caregivers on your own, you have to be sure you have coverage if they call off, get sick, go on vacation.
Right.
And they're not bonded and insured generally like the agencies are. There's positives and negatives to both. And we go through, I've helped people find, live-ins. I've helped people find through the agency, different caregivers. Part of what a geriatric care manager can do is go in and monitor that care, make sure that they're getting the care they're supposed to be getting, the agency's doing what it's supposed to do, can intervene with any scheduling issues or problems that the family's having with the agency. But assisted living, if you're looking at $15,000 a month for home care, maybe a little bit less, your assisted living, maybe you're looking at $7,000 to $10,000, $6,000 to $10,000, depending on the level of care the person's at.
Okay.
And a lot of times it's more in the $6,000 range than the higher end. But it just depends on what type of care. And then if we're talking about dementia care units, those are expensive. Those are almost as expensive as a nursing home per month in general, depending on, and there's no Medicaid coverage for most of the dementia care units.
Oh my.
Yeah, those are specialized.
What does a nursing home cost, average?
A nursing home cost, on average, costs, let's say around $10,000, $11,000 a month. There's some in this area that are $13,000. There's some that are $8,500. So it's in between that. I'd say $10,000, $11,000 a month. And it's a lot of money.
So assisted living kind of ends up being the most economical,
Yes.
but if you need then additional care to bathe and
Right.
get down to the dining room and all of that stuff, then I can see
Your
how
monthly
cost would start going up.
your level of care goes up. The other place that you can think about is a group home, or there's some of these board and care homes that are in some of the communities. You just have to be very careful
Yeah.
as to who owns them
Yeah.
and how they're operating, and
what kind of care is provided.
yeah.
Now, I want to ask you one more thing, and then I want to talk about VA. So this is back to Medicaid. Some places will not provide care for Medicaid people. Is that correct? There are some assisted living and or nursing homes that say no Medicaid patient is allowed here.
More so on the assisted living side.
Okay.
Now, a lot of the assisted livings will say you need to be here for 2 years and then you can apply for Medicaid. You need to be private pay for a couple of years and then you can apply for Medicaid. And they only have a certain number of slots that they'll allow.
That's what I thought.
Yeah, that they'll allow for Medicaid. More and more are accepting, Medicaid, but it's still not universal.
Okay.
And most nursing homes accept Medicaid. There's a few still that don't, but most accept Medicaid. You won't know. There's not a hall where you go and there's all the Medicaid patients. The nurse doesn't know who's a Medicaid patient versus a private pay patient. Everybody's mixed in together.
Good.
It's not obvious.
Good.
And the other thing that I say to people that I always say, regardless of where your parent goes, they're going to get as good a care as you are involved in their care.
Yep.
So the more you show up at different times, the more you bring cookies, the more pleasant you are with the staff, the more involved you are with the care, willing to jump in. On that day when they were short-staffed and your mom had to wait 20 minutes to go to the bathroom and she soiled herself, if that's a one-time occurrence, don't make a huge deal out of it. You can talk about it, you can mention it, but don't be nasty about it. You've got to look at the long term. This is where your parents' home is now, and so you want to build good relationships with these people. And
that's very true. It's so easy to get angry, and then you're alienating the staff, and unfortunately, it's mom who's going to. Tell our audience about VA, because I know from hearing about this again with many older gentlemen, they don't even think that they're eligible for anything.
Right. Well, they hear that, for the health benefits, their income has to be under a certain level. And so there are two things they need to look at. Are they eligible for some health benefits versus are they eligible for this special pension called aid in attendance? And so the health benefits, they're very nice. If you qualify, you certainly can go to a VA doctor and get your prescriptions written out. They're usually about $9 a month for a 30-day supply. They will provide some home health to you.
Do they?
They will provide some home health to you. They will provide, the caseworker there, the social worker there, assesses what's needed. And I actually had a couple. Amazing. They were both veterans, and she had been a psychiatrist in the Army, and he had been in the Army, and so they were both veterans, and they needed probably, 8 or 10 hours of care a day at one point, and the VA supplied it all through this.
For free?
For free. It was amazing.
My word.
It takes a little bit to get qualified, and that's on the healthcare side. And they do look at everything, your assets, your income, and your condition. Now, the aid in attendance is easier to qualify for, and it can be just anybody in the community who is 65 years or older, who has been honorably discharged, served at least 90 days during an active period of war. And be careful about that, because a lot of times the government considers an active period of war before the conflict happened and after the conflict happened. So the dates are a little bit different than what you might think. So you may qualify even though you think you don't. And then your medical expenses have to take up a significant portion of your income, and your assets need to be under $130,000. And so I think that, a lot more people can qualify for that.
If they knew about it.
If they knew about it. And, they'll come to me and they'll say, well, Dad's going to need home care, so you need to get me the aid and attendance benefit right now. And I'll say, I can't get you the aid and attendance benefit until you start paying for care. And Dad says, I'm not going to pay for care if I don't know if it's a sure bet. I can't guarantee that they'll approve it. I can't guarantee that they'll approve at 100%. What is the benefit for the veteran themselves? It's up to about $1,900 a month. For the surviving spouse, if she gets sick, she can get up to $1,200 a month. Rough numbers, $1,220. And so, so it's a significant amount of care that it can pay for. Sometimes you're just on that edge where you need somebody to come in the morning to get you up, get you bathed, and get you dressed, and then you're good for the day. And in those situations, a little bit of home care is all you need, and if you can get it paid for that way, that's great. They count prescriptions, they count your insurance premiums, they count all of that when they're looking at, what are your expenses.
Terry, believe it or not, we have 1 minute left.
Oh.
I knew this was going to happen. Thank you. How interesting. Geez, I wish you had been around, truly, 15 years ago. You have just watched, hopefully, an excellent episode of this show. All of the information about how to contact Terry Donner will be given to you at the very end. So stay tuned and you'll see how to contact her by phone or email. And thank you so much for watching.